Good evening and welcome to the CBS 4 Coronavirus Special Know the Facts. I'm Debbie Knox.
And I'm Lindsay Eaton. Over the next 30 minutes, we're updating you about the facts on this pandemic and getting answers from the experts about the health of the Hoosier State.
And we start tonight with the latest numbers from the State Department of Public Health. Tonight, nearly 9,000 people have tested positive for COVID-19. 436 Hoosiers have died because of the virus. Nearly 49,000 tests have been reported to the state. Now, during his afternoon news conference today, Governor Holcomb talked about the factors weighing the decision to eventually reopen Indiana's economy. Holcomb says the number of cases and deaths, as well as the state's ability to administer widespread testing, will all be considered before a rollout process begins. The state is communicating with companies right now on how to safely conduct business and getting them proper personal protective equipment to do so. The governor says that everything is on the table when it comes to safety precaution.
We're on the right path and we're making progress every day. But I've said from day one that while we may be one of the first to go into this, my goal is to get us to be one of the first out of it.
Another important factor is the ability to do contact tracing and to warn everyone who was exposed to a sick person so that we can stop the spread of the virus. Now, that process would need a lot of manpower. State officials say they could use either volunteers or they might fund workers. Tens of millions of Americans are receiving coronavirus stimulus payments now. The first payments are going to people who filed tax returns in 2019 or 2018 and who received money by direct deposit. One of the most asked questions for tax experts: do you have to pay taxes on the amount that you get or pay it back? The experts say no, it's meant directly to stimulate the economy. We also ask, what's the best way to spend the money that you might receive? Economists say it depends on the situation that you're in, whether that means save it, pay bills, buy something, or help others.
So there are a lot of folks who are, losing their jobs or getting their hours cut back and all of that. And they're going to need those bills. It's absolutely a good purpose for it.
Don't believe what you see on social media. Not everyone out there knows. They hear, and then those things spread. So clearly, that's the best thing to do is reach out to a tax professional. Just ask the question. That's what we're here for.
Now, officials say payments to Social Security recipients should begin later this month. Paper checks are expected to start going out in early May. In just a few minutes, we'll speak with an expert on the impact that he's expecting to see and when everyone starts getting their payments.
An order by the state health commissioner now has some county health departments clashing with state officials. The order issued by Dr. Christina Box allows long-term care facilities to relocate patients or residents within a facility and between facilities. The state order also voids any local order contrary to this one. Some counties feel this puts facilities at more risk and endangers the health of residents.
So far, we're doing pretty good because we're starting to see the leveling off of the new patients showing positive and deaths. So we thought we were doing pretty good, so why change it? The idea of transferring people out to either a clean facility or another infected facility, the strain it would put on families as well as the patients who are already chronically ill, right?
Dr. Box made it clear that all patients would be tested before transfer, whether showing symptoms or not. The state order also voids all local orders contrary to it. This includes one recently instituted by Delaware County that prohibited anyone from being transferred into the county from an out-of-county facility. State officials are looking to a coronavirus outbreak model developed by the Fairbanks School for Public Health. The Fairbanks model looks deeper than national models into Indiana's 92 counties. It tries to determine where the coronavirus has taken hold and searches for clues as to where it may be going.
We believe that Indianapolis and the rest of and the other parts of the state will hit their peak over the next few weeks into early May. Our level of hospitalizations in the center part of the state have been flat. In other parts of the state, they're still climbing up.
The Fairbanks model and another widely reviewed national model both predict more than 800 Hoosiers will die from the coronavirus.
All right, we are joined now by way of Skype by Dr. Ram Ulleti, the Community Health Network Chief Physician Executive. Dr. Ulleti, thank you for joining us tonight.
Absolutely. Nice to be back.
Well, first, doctor, we want to ask you about that state model and what it's saying about the surge. What is the timeline you're preparing for right now in the hospital?
So I think one thing we need to keep in mind when we talk about a surge is that when is there going to be a big peak where the hospitals can't handle the capacity? So far, luckily, knock on wood, thanks to the work of the governor and the mayor, we've actually seen it flatten a little bit, meaning that we're able to handle the number of patients coming into our hospital systems, that we're not going to exceed our capacity. But as you just heard, though, we may still end up seeing, another 300-400 deaths from Hoosiers. So simply because the peak may be coming very soon doesn't mean we're near the end of this at all.
Dr. Uletti, since we spoke to you, I think it was last week, you have recovered from your bout with COVID-19. So first off, how are you feeling? And then if you could, walk us through what you went through. When you noticed the symptoms, how you felt, what was the worst that it was?
Sure, absolutely. First of all, thank you for asking. I feel essentially completely back to normal. It's been over 3 weeks now, so I've recovered fully, and I feel like I have my full energy back and feel great. For me, how it started off was just a mild, scratchy, sore throat and a little bit of a cough. Didn't really have a fever. And then as things progressed, I felt I was doing pretty good, but then you kind of suddenly hit this wall, and I suddenly just felt a lot of fatigue where I was sleeping a lot during the daytime, 15, 18 hours a few days in a row. So that fatigue and this sleepiness was not something I was expecting. And I'm the type of guy that only spends a few hours sleeping at nighttime. So that was a pretty big shock to the body.
Yeah, I want to mention that
finally, it took a while to recover. It took about 20 days, though, for me.
Yeah, we want to make sure the timeline is correct. We spoke to you a couple of weeks ago, so people know that we're all on the same page there. Go ahead, Lindsay.
Oh, goodness. Well, we are so happy that you are feeling better. So we do want to ask you, in the last couple of weeks, the shift has really focused a bit on people who are asymptomatic and maybe spreading this virus and really not knowing it. How has that shifted things in terms of treatment and in terms of the spread of the virus?
I think that's actually very important to note, that there may be people out there that actually have the coronavirus in their body, and they could be contagious, but they don't realize it. So the key to what you do for that is to wear a mask when you go out in public. People think that you wear a mask to protect yourself from getting the disease, but the main reason everybody should be wearing masks when they leave their home is to make sure that they don't accidentally infect somebody else. And I think it's very critical, along with obviously a very aggressive hand washing and not touching your face.
And like you were just mentioning, we've had a lot of people calling and emailing and asking if masks should be required for everyone when they're out in public. Now, do you think this would help with keeping the surge down and essentially flattening the curve?
I think there's value to that, yes. And I think what people need to remember is just any facial covering. It doesn't need to be some hospital-grade N95 mask, but the idea is not to protect you, but make sure that if you may have it, you don't give it to somebody else. So the idea of all of us wearing masks when we go out, or some kind of facial covering, is, I think, a good idea to really reduce, because it's a very contagious virus, and wearing a mask may reduce how contagious that is for other people.
Yeah, I wish we could all get masks. I've talked to a lot of drugstore people, and they don't even have them in. It's hard. It's probably a little easier for you, Dr. Uletti, because you're in a hospital, but a lot of folks are still going without. They're using bandanas. I got a question here for you that I want to ask. A lot of people are feeling very antsy. They have been in their homes now for about a month or so or something. They couldn't be with their family at Easter time. We're hearing people saying, we got to get through this. We're going to get past the surge. What do you say to folks who are a little antsy and they just want to return to things the way they were?
I think probably a couple things. I think we're not going to, unfortunately, I think to be honest, we're not going to see things getting back to what I call normal for a long time, several months or even a year. So we're going to be living in a different world because this virus still remains contagious. Again, the fact that the curve is flattened doesn't mean the virus is any less contagious or any less deadly. It's just we're keeping apart, so we're not seeing as many people infected. So what I would say is that while it's a struggle not to be with your loved ones, the best thing you can do to protect them is not to be with them right now. That's probably the best thing we can do. And let's just take 1 week at a time on how we could slowly get back to a little bit what we had before.
All right, Dr. Uletti, we're glad that you have recovered. We hope there are more stories like yours in the days and months ahead. Thank you for being with us tonight. We appreciate it.
Stay healthy.
Thank you.
And we are learning more about which populations appear to be most vulnerable to COVID-19. Patients with cardiovascular disease and type 2 diabetes have a higher risk of experiencing issues, along with people living with coronary heart disease and hypertension. African Americans are experiencing more COVID deaths in Indiana and across the nation.
What we know is that, for example, the burden of cardiovascular disease and type 2 diabetes is much higher among Blacks than other groups. And the burden of type 2 diabetes is higher among African Americans, Latinx, American Indian, Alaska Natives.
Now, in the month of March, the Centers for Disease Control found African Americans numbered 1 out of every 3 coronavirus patients. 90% of all patients had underlying issues such as heart disease, diabetes, or obesity. Determining who is susceptible to the coronavirus will help health officials understand the disease and how to beat it.
Well, if you've looked at the interest rates lately, you may have thought they are too good to pass up. As CBS 4's Angela Brower reports, it might not be the best financial move for every family.
A lot of stores and businesses have had to close shop due to the COVID-19 pandemic, but one industry appears to be surviving just fine. Real estate in central Indiana is stable, if not booming.
A little over 26 years in the business and back-to-back my best career months ever.
Lender Kurt Fancher says while some people are getting loans for new homes, others are locking in these low rates and refinancing.
That's pretty much what I spent most of the day doing today, is just trying to look at people's situations and working up numbers and seeing if it makes sense or not.
Those rates going from nearly 5% this time last year to, on many days, the mid-3s.
I would have never predicted that we would have seen them drop the way they have.
So is refinancing right for you?
They're down now. I don't know how long they're going to stay this way.
Fancher giving us all some free advice.
Certainly ask. There's a lot of different ways to do things. So my advice is usually, if you're wanting just to try and lower a payment through the interest rate, there's always going to be costs involved. So look at what it's going to cost, how much is it going to save me, as long as I'm, keeping a similar term.
Or he says you can shorten the term.
You've got a higher rate, go to a lower rate, keep your payment around the same, and cut years off the term of the loan. And I think that's an excellent strategy.
Maybe buying a new home is what you're after. A heads up, there will be some changes. Realtors saying you may have to tour houses virtually, and most likely you won't be allowed to attend the inspection.
We need to facilitate some time for the guys to be able to do the inspection and then place a phone call or a Zoom call after the inspection.
Randy Surratt with Cornerstone Inspection Services telling us his employees are taking extra precaution, wearing gloves and using a whole lot of hand sanitizer before touching anything at all.
Are you surprised by the amount of business that you're still doing?
Yeah, I've got some friends in Washington, D.C. that have lost 75% of their volume in the matter of 10 days. We've only dropped about 25 or 35%, give or take. But yeah, I'm surprised.
In all, if you are looking to buy or sell, there's good news for you too. Almost every Hoosier that I've talked to said their closing process went smoothly, that it was on time despite the pandemic. In the newsroom, I'm Angela Brower, CBS 4 News.
Good to know. Thanks a lot, Angela. Well, still ahead, the next generation of Hoosiers stepping forward to help fight the pandemic. Coronavirus. Know the Facts returns in 2 minutes.